pregnant. She is not pregnant. Stay tuned and let's do this. Watch this video until the end. And if you have not subscribed to this channel, hit this notification bell, written subscribe, turn it on for future videos like this that I will post. Now, the number one thing that will be reported is that, doctor, I'm stressed. I'm really stressed up. I don't know why. I've not seen my menses yet. Pregnancy test is also negative. Is the pregnancy hiding somewhere in my body? Sorry. When you are stressed, you invite the stress hormones. The hormones that respond to stress, these are prolactin and cortisol. Especially the cortisol now will really play a very big role here. Both will play a very big role, the cortisol and the prolactin. When you are stressed, then the hypothalamus in the brain will sense that. It will sense that. Now it will suppress the release of gonadotropin releasing hormone. When this gonadotropin releasing hormone is suppressed, then there will be another suppression of luteinizing hormone and follicular stimulating hormone from the anterior pituitary gland. And when this luteinizing hormone and follicular stimulating hormone are suppressed, then there will be no development and maturation of ovarian follicle or Graafian follicles. Thereby, there will be no release of that ovum, and perhaps there will be no spermatozoa present to fertilize this particular egg, and therefore a baby forms. And then when we go reversely, and when the ovulation has taken place and there's no fertilization, then you will mense. You will see your menses. But when there is suppression, the way I've said, right from the hypothalamus, gonadotropin releasing hormone is suppressed, luteinizing follicular stimulating hormone and luteinizing hormones are also suppressed, then pituitary gland will not do its work and there will be no ovulation. Therefore, no menses. So when you continue getting stressed, no menses. Even if you think you might be pregnant, it can go even 4 months. So put stress aside and move on. I hope you've taken note into that. Number 2, weight gain and weight changes. This is due to when you are extremely doing an exercise to make your body to be lean, or you are eating too much. This will interfere with the menstrual cycle and there will be no menses, particularly when you eat binge eating or when you starve a lot.
Stop promoting your link in bio. Instagram recently began rolling out a brand new feature so that when anyone clicks on a link in anyone's bio,
exercising is very vital to our health, but if you do it too much, it will suppress the release of those hormones I've talked about. Therefore, you will make your body to be stressed. You will be inviting those stress hormones that I talked about from the adrenal gland, that is the cortisol, and you will not be able to see your menses. There's a disease called polycystic ovarian syndrome. Poly means many. When there is excess production of these hormones in your ovaries, then it will interfere with your menses. They will be irregular. Thyroid disease due to hypothyroidism, and hyperthyroidism due to increased levels or decreased level of thyroid hormones, both the T3, T4, and thyroid stimulating hormone will eventually interfere with your menses. When you are chronically ill, you've been suffering from cancer, or you've been suffering from HIV, or even TB for a very long time, you might be you might not be able to see your normal menses. There are some drugs that play a very important role in suppressing the menstrual flow, making the menses to be missed. When you have the contraceptives, when you are using contraceptive, maybe daily pill, maybe Depo-Provera, or these hormonal contraceptives, they normally interfere with the menstrual flow first, even the regularity of that particular menses. Antipsychotic drugs for psychosis may make you miss your menses. Antidepressant, and even those who are passing through a lot, those cancer patients who are undergoing chemotherapy, they might miss their menses because of this. When you are approaching your perimenopause, which might even start around 30. Sometimes you will start with the regular menses and then you miss it at all. Traveling and lifestyles. When you change time zones, this normally even happen here in our country, Kenya, particularly those who are from Nairobi to Nyanza, or to Western, or to Northeastern, and vice versa. When you change time zone and when you change an environment, you are likely to miss your menses. So I would rather advise that it's very, very vital for you to do pregnancy test. Breastfeeding also has, when you are breastfeeding, there is a high level of prolactin, and this normally suppress the menstruation and even ovulation, and this may make you miss your menses and you are not pregnant. That's why we encourage each and every woman that breastfeeding is very, very key, and it's another form of family planning. No, not much, but we encourage babies very, very well. So guys, it is very vital that if you experience all this I've talked about and you've missed your menses, and you had a sexual intercourse which was unprotected, or even condom burst, then you've done your pregnancy test and perhaps it is negative. It is advisable that you do this pregnancy test after 14 days, after 2 weeks, to verify that you are not pregnant. Thank you guys for watching this video, and if you have not watched about early signs of pregnancy, that video might be appearing somewhere here. Make sure you watch it in full. Give us your comments below about this video and the one that you've just watched, and we really appreciate. Subscribe to this channel for more videos that we'll post. Muchas gracias. In today's video, I'm still going to talk to our wonderful women. And we did talk about pregnant care, conception, when we were trying to have a baby. Time has passed, maybe 2 months, 3 months, and you are feeling some funny feelings in your body. Before I congratulate you, now let's have a chat about early signs of pregnancy. Early signs of pregnancy. Of course, the number one thing that you must put into consideration is that you have missed your period. Maybe 1 month, 2 months, and perhaps you are afraid, you are scared, you don't want to do pregnancy test. I want to remind you that if you are suspecting that you might be pregnant, before even we start discussing early signs of pregnancy, there must be a man who was involved. And also maybe you went for in vitro fertilization. If you are feeling this and you do not want to do a test, you missed your periods, of course, there are very many things that can make you miss your period, even if you are not pregnant. Hormonal imbalance, family planning, perhaps you are using family planning like Depo-Provera, daily pills, and you've stopped.
and you suspect. Extreme weight loss, whether you had an accident, you had trauma, you are psychologically stressed, or you are breastfeeding. If you are breastfeeding, there is high level of prolactin, which can make you miss your period. Whether you have polycystic ovarian syndrome, this one can make you miss your change of environment, even thyroid diseases can make you miss your period. Now, don't worry. We continue discussing early signs of pregnancy. If you feel nausea and vomiting, the one so-called early morning sickness or morning sickness, this is just due to the hormones that maybe are being imbalanced in your body because of pregnancy. Of course, there are other very many causes of nausea and vomiting, and also when your breast is swollen and painful, we call them tender breast. This might be a suspected sign of early pregnancy. When you're just becoming fatigued, even if you've not done any exercise, you are just tired. You are very, very tired. Early in the morning, you are just tired. You feel you want to sleep. It might be an early sign of pregnancy. When you have increased sense of smell, you have increased, somebody's cooking, a neighbor is frying some eggs, you feel it's times 3 of the normal smell, and you have a version of cravings. You need to eat anything that comes around. Some women normally eat even soil and stones, so it may be an early sign of pregnancy. Sometimes when you feel your lower abdominal pain, there are some cramping, and sometimes you have light spot. You see some blood in your panties. We call them implantation bleeding. It might be a sign of early pregnancy. Now, as men, we may understand you when you have mood swings. You are happy in the morning, you are sad in the morning. You have spikes of moods, different types of moods. In fact, you wake up very sad. If you have a husband, you don't even want to talk to the husband. We understand you. These are hormones working in your body. So mood swings are there. Sometimes you can feel bloating in your stomach and even constipation. It's a sign of early pregnancy. So you must be able to know that if you are bloating and sometimes if you eat and you feel constipated, is an early sign of pregnancy. Sometimes you can feel dizzy, and when it is in excess, you might even faint. You might even faint. So it might be a sign. And even your body just feel that your temperature is going high, is spiking. The basal body temperature is going high. Then it might be a pointing sign to early pregnancy. Backaches now and then, on and off, and sometimes if you bend, it might be very difficult to stand up as the pregnancy progresses, but early sign can also be a backache. When you check your breast and you see the areola, that black sides continue to be darkening of areola, it's a very, very might be a pointing sign. When you have an increased vaginal discharge rather than the normal discharge that you can see, leave alone discharge due to urinary tract infection or discharge due to vaginal candidiasis or even cervicitis. When you notice this, it might be a pointing sign of early pregnancy. Metallic taste in the mouth can be a pointing sign, and this apart from that craving we were talking about, you may have a lack of taste, and this one we call it dysgeusia, decreased taste. Sometimes even your very favorite meal, you start disliking your very favorite meal. It can be an early sign of pregnancy. When you have a pelvic discomfort, that is your lower abdominal pain, apart from that cramps I'm talking about, but you may have just a discomfort in your lower abdomen. This is maybe an early pointing sign of pregnancy. And we continue saying that there are very many things that can mimic this. In fact, sometimes some people do go blind when there's an early sign. It is rare, but it happens in most cases. per individual, different individual can even go blind for a short while, even for 24 hours, and they become normal. Even shortness of breath and some mild difficulty in breathing. These are rare and occasionally they happen on and off. All these factors that I've talked about are varying from one individual to the other. One individual to the other. You can't have all of them, but you may experience some. Because some people do develop nausea and vomiting in pregnancy, some do not. Some do develop tiredness, some develop headache. Now, more frequent headaches in the morning that disappear even without taking any analgesic or any Panadol. So you should be very, very vigilant that if you feel all those, we have differential diagnosis. There are some diseases that mimic all those we've said, like maybe malaria, typhoid, brucellosis. So it is very, very mandatory that if you have those feelings or you have those symptoms, kindly go for pregnancy test. Go for pregnancy test. And if pregnancy test is positive, congratulations. And in some few months, by God's grace, you will have a baby boy or a baby girl or even set of twins or sometimes triplets. We pray that everything to be all right. Next time, I'm going to discuss that drug that I promised you. Let me just show it to you. So I've congratulated you, and now when we had hardly discussed about this, and this is the one that we will discuss when we will want to maintain this our pregnancy. This is for preconception before you get pregnant. This is now when you're pregnant. This is what you are going to take till you deliver. Thank you so much for watching this video. And for men who are having low libido, erectile dysfunction, this is the best video for you. You can either watch Fertilion M or Manix. I want you people to avoid blue pill. Men, avoid blue pillow. Muchas gracias. See you in the next video.
Hello.
Most of my videos I've been talking about infertility, and I've been giving tips on how to deal with this particular menace. And I've been trying to inform us on the ways that we can do so that we reach at the main target of getting our baby. We want our women to be pregnant. We want our men's vitality to be at deck so that we be able to see our issue and have our heir apparent to our throne, that is our children. And today I want to introduce to you a very, very important drug that if you take when you are a female, you can be able to conceive very, very fast. In fact, within 3 months, you should be able to have conceived. You should be able to be pregnant if you use this particular drug. I'm talking to this particular female who has been running up and down, has done several tests, and maybe the doctor has said that your condition, there is no bigger threat. You can be able to get pregnant. Remember, if everything is okay and you've been screened for infertility and you are just okay, or if that problem you had has been solved, then this is the best video for you. Now, I'm introducing this drug, and its name is called Pregnacare Conception. Pregnacare Conception. Just see how it has been packed very nice and well, and being distributed. It is made in Britain. And the Pregnacare Conception is a very, very important drug in that it is formulated specifically with the nutrient to help to support conception. for women who are trying for a baby, when you are trying to have a baby, when you are trying to conceive. This is a very, very vital drug for you. And it contains some very vital elements that most of the time I've been talking about, like zinc, which contributes to normal fertility and production, and plus folic acid, which normally prevent neural tube defects, folic acid, vitamin B12, vitamin D, and other components such as L-arginine, inositol, beta carotene, and all vitamins, named vitamin D, E, C, B1, B12, B3, B6, B12, and some elements like magnesium, iron, zinc again, copper, selenium, and iodine. And these are very, very important during conception. And expert care while trying to have a baby, we are saying that now you have decided to try for a baby. You want to prepare your body and ensure a healthy diet and lifestyle. This special pregnant care that I'm vlogging about now, conceptual formula, has been developed on the basis of worldwide studies. They show that certain nutrients such as folic acid that I've mentioned can play an important role in helping to build nutritional stores ready for pregnancy, and zinc to support the normal reproductive health. It is recommended for every woman every female who is trying to have a baby. And the normal folic acid levels and zinc level are all recommended and approved by WHO. Now, what are the directions that you should be able to use this drug? Before I go and tell you more about that, you should be able to look at it and see how it looks like. This is how the drug looks like. Pack of ice, 1, 2, 3, contain 30 tablets. 30 tablets, which means when you take this two, this is for 1 month. It's 30 tablets for a month. Now, the directions is that one tablet per day with your main meal. Swallow with water or a cold drink, not to be chewed. Do not chew the drug. Do not exceed the normal intake, which is one tablet per day. And the use of pregnant care conception, as soon as you start trying for a baby, it will help to prepare your body. It can be used up to 3 months before you conceive. And now, when you are using this drug, it is not necessary that after maybe 1 month you conceive or 2 months you conceive. The time frame is 3 months. If you use it for 3 months and there is no change, or you've not conceived, then you can come back and consult us to verify what might be wrong. Of course, we'll continue monitoring your hormonal levels. Hormonal profile is very, very important in each and every female when you want to conceive. We'll do a test: follicular stimulating hormone level, luteinizing hormone, progesterone levels, estrogen levels. Those are very, very important, so that we know that there is no problem. Now, we continue saying that this comprehensive formula B1, B2, B3, B6, B12, all of them are in this drug. So it is very, very important also to supplement this with all ranges of fruits. As I've mentioned there, that healthy diet and lifestyle is very, very important. So fruits, all kinds of fruits and vegetables are very, very important when you are using this particular drug. Remember, pregnant care for conception, and it's very, very affordable, and you can get this at your nearest chemist. And if you are interested to get this drug, and maybe you've looked for it in the nearby chemist and you are not able to get it, we do an online delivery of this drug as affordable price. In the description below, there will be my WhatsApp number. You can either call or you text or you WhatsApp so that we can agree on how this drug can be delivered to you at your doorstep, provided that you meet the conditions that are required for this particular drug. I wish you the best, and I know within 3 months you have your baby. Within 3 months you have your baby, and after you have you ever wondered sometimes when ectopic pregnancies is one of the major complications that arise during pregnancy? And in this video, we are going to define what is ectopic pregnancy. We are going to classify the types of ectopic pregnancies, and we are going to look at causes or risk factors tethered into ectopic pregnancy. And also, we are going to typically look at the classical signs and symptoms depicting ectopic pregnancy and how can we diagnose and how we can manage this particular problem. And also, we are going to answer the common questions that you normally ask. Among them is, am I able to carry my child to term if I had ectopic pregnancy, or am I able to conceive when I had ectopic pregnancy? And is there any management of ectopic pregnancy rather than being taken to theater? Stay with me until the end of this video if you want to hear the answers of these things. And if you have not subscribed to this channel, please click the notification bell, return subscribe, turn the bell on for more videos that we will post. And if you love this channel, this M-Pesa number, just send something small to support this channel, or even this PayPal button down here in our description. If you send something, we'll really appreciate. And also, we appreciate our loyal subscribers that have been supporting this particular channel. Otherwise, let's do it and let's go to the real topic of ectopic physiology of female reproductive system. In terms of what I've said, normally starts when hypothalamus is sensitized to release gonadotropin releasing hormone, which normally triggers the anterior pituitary gland to release two important hormones, that is luteinizing hormone and follicle stimulating hormone, which normally work in the ovaries, sensitizing the thicker cells of the ovaries in terms of maturation and development of the follicles into the ovaries. And in this manner also in the important releasing of the important hormones, that is progesterone and estrogen. And this normally contribute to preparation of the uterus in terms of thickening the uterus, increase in blood supply in the uterine cavity, and also even thickening the cervical mucus. When a male releases the sperms and sperm is deposited into the vagina, travels to the uterus up to the fallopian tube for fertilization. Fertilization normally takes place and at the fallopian tubes, and the egg is released, or the cilius in the fallopian tube normally propels the eggs towards propel this particular egg towards the uterus for implantation. And normally around 6 days implantation has taken place, and this will just contribute to the normal development of the fetus. Now, how do ectopic pregnancy occur? Instead of implantation of the fertilized egg into the uterine cavity, now the implantation normally takes place outside the uterus, and that is what we call ectopic pregnancy. The word ectopic is from a Greek word ektopos, which means outside. Now, when this implantation takes place outside the uterus, of what we are going to discuss, the classification, the types of this implantation, this is what now we call ectopic pregnancy. And we are now going to classify the types of ectopic pregnancy. There are two types, that is tubal ectopic pregnancy and non-tubal ectopic pregnancy, which I want to show you in a diagrammatic manner so that you may understand.
My name is Munzir Dale. I'm a professor of electrical engineering and computer science at MIT. The partnership that we have with professional education.
The classification of ectopic pregnancy in terms of the sites, I've mentioned earlier that we have two types, that is tubal ectopic pregnancy and non-tubal ectopic pregnancy. And as you can see in the diagram, there are several parts that we mentioned. I want just to start with the documented part in terms of percentage, that is on the tubal ectopic pregnancy, where we find that the femoral end, as you can see in the diagram, contributes to about 5%, and the ampulla contribute to 80%, and the isthmus part contribute to 12%. That is a classification in terms of percentage. And non-tubal, we have the ovaries ectopic pregnancy consists of 0.2%. We have the cervical affecting the cervix, that is 0.2%, and even intra-abdominal, which is 1.4%. So as you can see in the diagram, we have the fallopian tube. It's about 10 centimeters long and 4 inches. And you can see the segments. We have the infundibula, that is the tubal part. Also, ectopic pregnancy can occur there. And also you can see interstitial, that is connual. Ectopic pregnancy can even occur there. And even the isthmic part, ectopic pregnancy can occur there. The ampullary tubal, that is the wider and also the longest one, and mostly occurring about 80%. Most of the ectopic pregnancy occur at the ampullary part. Ovary also is contributing to that. As you can see, also there's abdominal, and even apart from cesarean scar, intramural ectopic pregnancy can occur at that particular place, even at the cervix, that is the cervical ectopic pregnancy. So that is how we normally classify ectopic pregnancy. And after knowing that, we will also know that complications normally occur and severity normally occur depending on the site that has been affected in terms of signs and symptoms. One of the major causes of ectopic pregnancy is due to the fallopian tube defect itself, maybe due to inflammation causing scarring tissue secondary to diseases like pelvic inflammatory disease caused by either gonorrhea or even chlamydia can contribute to this. Hormonal imbalance can also be a contributory factor, and even development of the newly fertilized egg when it has defects, maybe genetical factors contributing to this particular ectopic pregnancy. When you are pregnant while you are using IUCD, it's a contributory factor. Not that if you use IUCD, it's a thumbnail that you are going to develop ectopic pregnancy. No, when you are pregnant while on IUCD, intrauterine contraceptive device can also result into ectopic pregnancy. Assisted reproductive technology, or people undergoing, or women undergoing IUVF, in vitro fertilization, can also result to ectopic pregnancy. Even the use of fertility drugs can also contribute to ectopic pregnancy. Smoking is also a risk factor, and it's also a cause of ectopic pregnancy because it's normally killing the cilia. Cilia are the ones responsible for propelling the fertilized eggs towards the uterus, and if they have been damaged, then there may be chances of that time of implantation delaying, and it normally takes place into the fallopian tube. And also those who have undergone tubal ligation can also develop this particular ectopic pregnancy. Even tubal reversal, those who have tried to do a reversal of their tubes when they had been ligated, can also result into ectopic pregnancy, and mostly nowadays is being discouraged. Diseases like endometriosis can also contribute to this because it normally affects the endometrium. So when the egg is released, there is no place of implantation, and even may lead to implantation at the cervical area or at the cervix, as you saw in that particular diagram. age is also a contributory factor towards ectopic pregnancy, and those who are 30 to 35 year old, when they get pregnant, they have high risk or high chances of developing ectopic pregnancy. As you can see also in my videos when I talked about infertility in women, if you have not watched that video, watch that video that appears here. We talked about age as a contributory factor to infertility. And when you get pregnant at older age, you may also develop ectopic pregnancy. So it's very, very advisable to get pregnant in your early. Typical signs and symptoms of ectopic pregnancy are always 3 plus other additional. When you have amenorrhea, when you have missed your menses and you have abdominal pain and vaginal bleeding, this is a pointing sign towards ectopic pregnancy. In fact, we will be thinking of ectopic pregnancy other than abortion at the first place, because ectopic pregnancy is very, very vital, particularly when it has ruptured and you start bleeding intra-abdominal, because ruptured ectopic pregnancy, mostly bleeding is intra-abdominal, not vaginal. So a woman may present with low abdominal pain preceding to very severe, and also pain at the right or the left flank, depending on which type of which part of the fallopian tube is affected, with either right or left, or sometimes even bilateral, which is normally rare. And this woman will also present with vaginal bleeding, which may proceed to be light at the beginning and very severe at the end, and this may even result into low blood pressure and even high pulse rate, and this woman might even depict signs and symptoms of shock. And also some signs and symptoms that are not necessarily tied to this: you may develop dizziness, nausea, and even vomiting. And also first trimester pregnancy signs like what I've mentioned, and also breast sores and breast tenderness may even be occurring. This one may even show you that you are pregnant, and you may confirm this by doing a laboratory test of pregnancy test, and this one can also depict that you are pregnant. Of course, if you come to us clinicians, we know what we do. We normally do paracentesis, and if you find unclotting blood, is typical of what is called ectopic pregnancy, particularly on the left or right flanks when we aspirate that particular blood. And this normally occur when there is ruptured ectopic pregnancy, which always is a life-threatening, and it is an emergency that the patient might be taken to theater in that very presentation of shoulder pain. This is due to irritations of the diaphragm, and this is called a referred pain because following the nerve roots, the phrenic nerves that normally go towards the shoulder. So a patient might present with shoulder pain secondary to this particular issue, and this shoulder pain is also very pathognomic of ectopic pregnancy, particularly the ruptured ectopic. Diagnosis of ectopic pregnancy: we normally consider any woman who is presenting in the hospital with a low abdominal pain, amenorrhea, and vaginal bleeding will think of ectopic pregnancy, and first we'll confirm whether this woman is particularly pregnant or not by doing a pregnancy determinant test, whereby we confirm if the pregnancy is positive or not. Of course, there are other tests that we will verify to consider, like full blood count, that is complete blood count, liver function test, urinalysis to depict any infection that might have occurred. Also, we'll do a typical one which has 90% sensitivity rate, that is transvaginal ultrasound, that will now show us which part of the ectopic pregnancy are we talking about, whether it is tubal or non-tubal. And also, if there's no transvaginal ultrasound, we can just do obstetric, the normal scan, and this one can also show us. Also, we can do what we call kuldosensitis, which is normally done by the gynecologist, or also we can do dilatation and curettage, which is also done by gynecologists. And also we can proceed to do what we call laparoscopy, the viewing of the tubes to verify which part of the tubes has been affected. Also, we can do beta HCG levels to verify from the normal, considering the protocols of diagnosing ectopic pregnancy due to with the use of beta HCG. Progestin levels, when they go below 20 nanograms per liter, also can be very predictive value of ectopic pregnancy. So if you're in a facility that progesterone levels can be done, it is very mandatory to do. Management of ectopic pregnancy is two ways. We can use medical management or surgical management. Medical management is pegged on an ectopic pregnancy which has not ruptured, and we'll use a drug called methotrexate, and this one you will be administered into the ward. This will kill that particular fetus and prevent it from development, causing more problem. Also, there must be rules and regulations that you must follow before this drug to be given. First of all, you must be able to not get pregnant after this particular medication, and also be able to be attending clinics so that your beta HCG levels to be monitored, even your liver function test or kidney function test and full blood count to be monitored, as you know this drug is very lethal and fatal. So it is very, very necessary for you to be given this drug if at all you do not want to opt for surgical intervention, particularly when it is not ruptured. So the question that people normally ask, that is there any way that my ectopic pregnancy can be managed without going to surgery? Yes, there is, but when it is not ruptured. Ruptured ectopic pregnancy needs surgery. You can either remove the particular part which has been affected, or we remove the ovaries plus the fallopian tube, that is salpingo-oophorectomy. That is a surgery that is done by qualified gynecologists. They can just only do salpingectomy, that is only removing the part of fallopian tube that has been affected. They can do explorative laparotomy to check which particular ectopic pregnancy has occurred, particularly when it is abdominal ectopic pregnancy. Laparotomy will be very, very vital in this particular scenario. To answer a question that mostly people ask, that will I get pregnant when I have ectopic pregnancy? This will depend on the type of surgery and whether ectopic pregnancy was bilateral, that is meaning left or right side, or whether these particular tubes were removed or not. If you have bilateral ectopic pregnancy and both tubes have been removed, there is no way you will get pregnant. So normally discuss with your gynecologist, and before maybe signing that particular form before you go to theater, or if it is a part of emergency, you will be explained for the surgery that had occurred. If it is one side of the tube, then you are still likely to use the other tube to get pregnancy. Yes, you will conceive with this. If you love this channel, please click the notification bell, written subscribe. If you are the first subscriber, turn it on for more videos that we will post. And if you really love us, also contribute towards development of this channel by this M-Pesa number. Otherwise, muchas gracias, and see you in the next video.
Hyperpigmentation innovation. Melicil, patented until 2036. The new active to intercept excess melanin before it marks the skin. Superior anti-pigmentation efficacy. Now in Mela B3 Serum by La Roche-Posay.
For you to pursue diploma in nutrition.
Most women who are presenting with nipple discharge or discharge from their breast normally think of breast cancer. But I want to tell you today that most causes of nipple discharge are not even related to breast cancer. So in today's video, we are going to discuss about normal nipple discharge, abnormal nipple discharge, what are the possible causes of this nipple discharge, what are the laboratory stroke imaging investigation that we can do to help us in diagnosing a nipple discharge, and how we can manage nipple discharge. If you have not subscribed to this particular channel, hit the notification bell, written subscribe, turn it on for more videos that I will post. Now let's go and let's do it. Nipple discharge can be normal in that it can be clear, it can be yellow, it can be brown, green, or white.
and this one normally occurs in both breast and occurs only when the breasts are squeezed or the nipples are squeezed, and comes from several milk ducts of the breast. But we normally say that the color of the breast nipple discharge is not a better way of diagnosing breast disorders, in that there can be normal or abnormal discharge related to the color. Kindly note that when nipple discharge is not normal, then it may be bloody and it's occurring only in one side of the breast. It comes out on its own without squeezing or even touching this particular nipple. And it can be also accompanied by symptoms like pain, redness, or even swelling and changes in this particular nipple. Now, if you note this, this can be due to abnormality in nipple discharge. And there are several causes that I want us to take into consideration. And one of the major causes of nipple discharge is hormonal imbalance. Hormonal imbalance can occur during a menstruation period or during perimenopause or even menopause. When there is pregnancy or during lactation, and it is normal, this is a discharge that everyone knows, and this is milk, which is due to breastfeeding or even pregnancy, and that is normally normal. Birth control pills can affect your hormones, and this one can result into nipple discharge. Drugs such as antihypertensives and antidepressant can cause nipple discharge. Antihypertensives like methyl dopa can also cause this, and even antidepressants such as paroxetine can also cause this particular breast discharge. Non-cancerous breast cyst or breast swelling as a result of a cyst can result into nipple discharge, and most of these discharge are greenish in color and does not show any sign of breast cancer. Now, when you have you put on a tight brassiere, or your clothes can be constantly in friction with this your breast,
It was never a conversation.
Or your nipple, and this can result into nipple discharge. When you have your partner and you are sexually aroused in women, and this one can result into breast discharge or a nipple discharge because of the increased prolactin level. Injuries of the breast can also play a very, very important role in nipple discharge. Stress management is very, very key, because those who are psychologically stressed, those who are stressed in that they cannot manage this particular stress of theirs, these females tends to have increased prolactin levels, which normally induce the discharge. So we normally advise for stress management if at all you are undergoing such a psychological torture, or you are experiencing some kind of stress. It is very, very important, because this one normally brings discharge. Now, there are people who have been diagnosed with papilloma, breast papillomas, and these are non-cancerous growth that does normally affect the breast, and sometimes they can be clear discharge or even bloody discharge. So breast papilloma or papilloma can be diagnosed through ultrasound, even MRI, even CT scan. So this one can also bring a discharge from your breast. Breast infections like abscess can also bring discharge, and most of these discharges are yellow in color. There's a impression we call mammary duct ectasia, when the mammary ducts are widened, and this normally pose great risk, and this brings a lot of discharge in your breast. When we check your thyroid functions, and there's a condition we call hypothyroidism, where there's a reduced thyroxine levels. Pituitary gland tumors such as adenomas, or what we call prolactinoma, due to increased prolactin levels, can bring what we call milky discharge. This is due to that tumor called prolactinoma, and this can result into your breast discharging milk. Fibrocystic breast tumors or breast disease can bring breast discharge, and lastly, we have what we call breast cancer, of which people are normally fearing, and this normally is very, very rare, but if it occurs, it's a clear discharge from your breast. So for us to diagnose this particular problem, or to find the reasons for your breast or nipple discharge, we need to do thyroid function test to rule out what we call hypothyroidism, that is the reduced T3 and T4 levels. And also we need to know the levels of prolactin in your blood, because we talked about prolactinemia, which normally causes nipple discharge, particularly those who are suffering from what we call pituitary gland tumor, the prolactinoma. I was talking about mammography, X-ray of the breast, or even ultrasound of the breast, that is called mammogram. It's very, very helpful, particularly in diagnosing papillomas, abscess, or mammary duct ectasia, or even fibrocystic breast, or even sort of few changes in the breast as a result of breast cancer. CT scan, very, very vital. CT scan of the brain will help us to rule out what we call prolactinoma. The one I've talked about. Biopsy, that is, we take a chunk of tissue from your breast, and then we subject it to what we call histology, histopathology, and we find out whether it is cancerous or non-cancerous. Ductogram is also very important. It's a method of mammogram that is normally helping in diagnosing this particular problem. And of course, now management is usually case by case. From all those causes and investigation, when we find that it is due to drugs, then we isolate the offending drug. If it is due to infection, we introduce those antibiotics. If it is breast abscess, we can even do incision and drainage. And even if it is due to papilloma, we can do lumpectomy, or we can remove those particular lumps that are there. We can do ductectomy or microductectomy, just to protect and to drain all those discharges that are coming from the ducts that are affected. So those who normally have a lot of fear that if they have breast discharge or nipple discharge, what is reigning in their mind is breast cancer. Before you even think of breast cancers, all those particular screening must be done to arrive at correct diagnosis. If you have not watched the live video I did about nipple discharge, it may appear in one of this particular video that's appearing in between this discussion. Otherwise, if you have not subscribed to this channel, hit the notification bell, written subscribe, turn it on for more videos that I will post. Muchas gracias. See you in the next video.